Today's topic is going to be a health topic. It's something that has been on my mind for quite a while, and especially with the increase of this condition, I just feel very compelled to talk briefly about it and talk about different ways and tips to help you and your family get better with this condition. Hello everyone, and welcome back to my channel PLife, the pharmacist life. I just want to say a huge thank you to every one of you that keeps coming back to my channel and watching me, whether my vlogs or my health talks or anything to do with me on my channel. So I am so grateful and thank you so much for coming back to my channel. Today's video is going to be a health video. It's something that has been on my mind for a while, and it is something that I've always wanted to talk about for a while. The ages of 30 are starting to have high blood pressure. It is something that we are seeing a lot in the pharmacy, and it was just something that was on my heart. I really felt that I should be sharing today, so I hope you learn one or two things. Guys, what is high blood pressure? High blood pressure is an increase in your blood pressure in the arteries. What should be the normal blood pressure readings? Normal blood pressure should be between 120 to 140 over 80 to 90. Okay, so when your blood pressure is going over that, especially over 140 over 90, then it is a cause of concern. And so how can you identify, or how can you know that you are suffering from high blood pressure? First things first, we call high blood pressure a silent killer. It is not a condition that you get to know straight away. It builds and builds, and then can cause other effects. It can affect your organs, such as your kidney, your heart. It can also cause heart attacks, stroke, heart disease, or kidney disease. And so knowing that your blood pressure is at the right level is very, very important. How can we know if your blood pressure is high? You can know through a few symptoms. If you are starting to have persistent headache, and your headache is not going regardless of the painkillers that you use, then it is very ideal to go to your nearest pharmacy and get your blood pressure checked. That is one of the main symptoms. If you are starting to also feel very, very tired for no reason, that is also a symptom. If you're getting a lot of pain in the eye, that is also another symptom. You should also get your blood pressure checked. If your family has a history of high blood pressure, it is very, very important that you go to your nearest pharmacy and get your blood pressure checked. Other symptoms of high blood pressure include, like I said, severe headache with no painkillers relieving it, pain in the eyes, especially vision problems. If you are feeling very tired and feeling confused all the time with no reason, that is a symptom. If you're having difficulty in your breathing, if you're struggling to breathe, that is another symptom. If you have pains in your chest, it's another symptom. These are the symptoms to be worried about. As I said, if there is high blood pressure in the family, you should also get to the nearest pharmacy and get checked, especially if you're suffering from these symptoms. So, how can we try and prevent high blood pressure, Elizabeth? What can we do to make sure that our blood pressure is not on a high level? I will be sharing a few tips that I recommend to patients in the pharmacy as to ways that you can reduce your blood pressure, and I hope this would help you and your family member or someone that you know that could be suffering from high blood pressure. If you notice any of those symptoms that you're suffering from that I listed before, and you've gone to the pharmacy to get your blood pressure checked, if you were told that your blood pressure is between maybe 140 to 150, we normally would recommend sort of a 24-hour blood pressure check. So we get to check your blood pressure within 24 hours. We recommend that you buy a blood pressure machine and check your blood pressure for the next 24 hours to see if it is persistently high. If it is not, then we always suggest a lifestyle advices. So lifestyle advices would be what your diet is like. Are you exercising? Are you having enough sleep? Are you drinking enough water? So with your lifestyle, it really improves the blood pressure. Your diet, what's your diet like? Are you having a massive salt intake in your diet? If your salt intake is more than a teaspoon a day, which is 6 grams, then it means that you are having too much salt in your diet, and that can absolutely increase your blood pressure. So you want to be having a teaspoon daily only. So to my African people, I know we love our flavors and we love our seasonings. We need to be very careful with our diet. We need to be careful of what we're putting in, the seasonings we're putting in. Some of our seasonings can be quite carcinogenic, so normally recommend that you should watch what seasoning that you're using and only use considerable amounts. Okay, we love our oils. We need to be very careful with the amount of oil that we put in our diet. We don't want to be using a lot of oily products in our diet. We don't want to be eating a lot of grease and fat, because that can clog up the arteries, increase blood pressure, and then cause blood clots, cause heart attack, or cause stroke. We don't want these massive other conditions to affect our blood pressure. Okay, so we need to be making sure that our diet is filled with a lot of fruits and vegetables, less fatty food, less processed food, less salty food. We need to be eating as much fresh food as possible. I hope you understand where I'm coming from, because it really reduces blood pressure. My other advice, like I said before, is making sure you sleep well. Try and make sure you are having 6 or more hours of sleep in a day. You could be like, oh Elizabeth, how can I do that? My life is busy, I have a busy lifestyle, I have a busy hectic lifestyle. It is very important to have a strict regime. If you're someone that has a very hectic lifestyle, you need to have routines, strict routines, to just help you make sure that you are having 6 or more hours of sleep every day. Stress also plays a huge factor. There is an increase in the stress levels of everybody. Even I myself, I can say that there's been, the older I get, there's just an increase in my stress level. Sometimes I always say to myself, I wish I was still a baby, I didn't have any bills to pay, I didn't have to grow up, because growing up is part of life and it is intense. Sometimes, you know, life throws different curveballs at us, life throws a lot of things at us, and that can increase our level of stress. Stress can be a good thing, and it can also be a bad thing. Obviously, the extreme of everything can be, you know, bad for us. But we need a little bit of stress, a little bit of pressure in life for us to move forward, for us to grow, for us to become better. But obviously, as we grow from that stress, that good stress, straight into more stress, it can be very bad for us. So that's why we need to make different ways, or find different ways at controlling your stress levels. Find different ways at making sure that your stress levels are not getting too bad. had through either meditation, you know, yoga, relaxation. Those are very good ways of just relaxing and reducing blood pressure. Blood pressure needs to be reduced, otherwise it can lead to all those diseases that I've mentioned earlier. So if you need to go to a spa day, if you need to find a massage therapist, find anything that you know that helps you reduce your stress levels. You know, research on it, find out what works for you or what works for your family. That would definitely be able to help. Exercise as much as you can. NHS and healthcare professionals normally recommend 30 minutes of moderate to high intense exercise a day. And if you can do that for 5 days a week, that is good. If you already suffer from high blood pressure, heart conditions, kidney disease, then we say gradually build your exercise levels. Just gradually build it. Don't go too intense, don't go too high. Okay, just gradually increase it, gradually build it, and then you are helping the blood flow. We want to make sure that the blood is flowing as much as possible. If you have any concerns about your blood pressure, or you need any help with understanding more of high blood pressure, don't hesitate. Just send me a message. You can reach me in the description box below. I've put different ways of how you can reach me. Reach out to me. And if you find this of good value to you, just make sure you like, comment below and subscribe to my channel, because I love to do these health talks and I want it to be very much part of my channel. So the more I'm getting more engagement and conversations with any of you that need help with the health, the better. Thank you very much guys for watching. I hope this has been of great value to you. Just reach out to me if you want to. I'll be glad to help. Don't forget to drink the water. You need a lot of water to flush out every toxin and to regulate your blood pressure. Don't forget to eat your fruits and veg. It's highly important. You can also take supplements as well. It really helps. Okay, and reduce your salt intake. To my African people, reduce your salt intake. Stop eating too much oil. Okay, it will reduce your blood pressure. And to all my anybody else from any other parts of the world, this applies to you as well, because I know my Asian people like a lot of flavors in their food. I know my other parts of the world, if you like flavor, it means you like a bit of salt in your food. So keep an eye on that. Thank you very much. Have a beautiful week. My love to you. And this is PLife by Elizabeth. Thank you so much for watching. Have a fantastic week. Thank you. Bye bye.